Too many mothers-to-be are dying here in Alabama. For years, Alabama's maternal mortality rate has been one of the highest in the nation. But could examining those deaths more closely prevent others in the future? That's the idea behind an autopsy program already underway in Mobile and Baldwin counties, and one that will soon be expanded statewide. NBC 15's Darren Singleton spent today learning more about the program. Darren, this is a very sensitive subject.
Well, it is, Kim. It's talking about death when you're prepared to celebrate the beginning of life, and it's never easy. But you're about to learn why health leaders in the state say it's vital if you want to save more moms in the future. Having a baby, it should be one of the most joyous times in a woman's life, one shared by family and friends. But too often in Alabama, pregnancy devolves into sadness and confusion. Too many mothers-to-be are dying. Alabama's maternal mortality rate is one of the highest in the nation. It was something that so alarmed the Alabama Department of Public Health 5 years ago that they knew they had to do something.
We needed a committee to really dive deeper into the causes of these deaths. And so our committee was established in 2018, and we started reviewing deaths in 2019, and have reviewed deaths ever since then to try to figure out what the causes are of our high rates.
So they looked at 93 deaths in 2018 and 2019 that seemed to fit the parameters of their study. And what Lindsay Harris and her coworkers at ADPH discovered was concerning. 24 of those deaths were determined to be pregnancy-related. 15 of those deaths could have been prevented. Those deaths for black women appeared to nearly double those of white moms-to-be. What they need now is even more information, and the best way to get that is by performing autopsies on those who have died near or during their pregnancies.
We have several deaths that happen each year that we review, where typically these women either die at home or come into an ER and die, and so we don't know any care they've received prior to that. Because we just don't have the records to show us that. So if we have autopsies performed on these women, it will definitely give us a lot of answers that we aren't getting otherwise.
That's why late last year, ADPH implemented the maternal autopsy program in Mobile, Baldwin, and 8 counties in the Birmingham area.
What do you want families to know? That this is a really tough time in their life, but it could give that death some purpose, couldn't it?
It sure could. It could give the family answers, because a lot of times the families don't even know.
The autopsies are done at USA and UAB, and while the study committee is eager to get that information, they'd rather it not be necessary at all. That's why they want expecting moms to follow their doctor's orders and this advice.
Seek care as early as possible when you're pregnant. If you question anything that is going on, whether it's a simple headache or you feel dizzy or you just think something's not right, don't be afraid to call or go see somebody.
So who will ask these families if an autopsy can be performed? Well, if the death is at home, it could be a paramedic, the coroner, or a police officer. At a hospital, probably a physician or a nurse. It is a delicate question, but one that could make a big difference, Kim, for families in the future.